Today we are going to talk about why it is not a good practice to routinely separate mothers and babies post-birth. It has become a fairly routine practice in most institutions to separate the mothers and babies immediately after birth. The baby is born, the cord is clamped and cut immediately. Baby is then moved into an infant warmer where maybe someone checks the baby, and if it's a cesarean birth, then it's very common for the baby to then be taken away into an infant nursery, maybe to be observed for some time. But really one of the things that we should know is that the best place for the baby to be is with the mother immediately after birth. Think about this. We are mammals. Think about even our pets like dogs and cats. When the puppy is born, if somebody else touches the puppy, it's very common for the mother dog then not to accept that baby. The fact that we are mammals and we have a brain, we say, okay, this is my baby, I'm going to accept it. But there are many other physiological changes that are happening in both the mother and the baby at the minute of birth, which warrant keeping the baby as close to the mother as possible. One of the World Health Organization recommended practices, as well as many organizations such as Lamaze endorse the practice, is that mother and baby should not be separated, and mother and baby should be kept in skin to skin contact. Then there can be a cloth that can cover mother and baby, but really skin to skin contact of mother and baby is what is known to promote the best physiological changes for both the mother and especially the baby at birth. So baby has been inside the womb for 9 months. It has been hearing the mother's heartbeat, hearing the respirations. As soon as it comes out, when it is put in that familiar environment, the familiar habitat where it has been kind of protected for the last several months, that baby then automatically kind of synchronizes its breathing and synchronizes its respirations to make sure that it can then feel protected in that environment. Also, what we know is that the mother's body kind of is the best temperature, a baby warmer that a baby can have. When the baby is separated out, there can be external warmers, but it takes a lot more for that baby's temperature to get regulated as compared to when the baby is right on the mother's chest. There is another component to this as well. When the cord, the placenta is still inside the mother, the cord is meant to be only so long because that baby should ideally not be separated from the mother at all. This cord has carrying nutrient dense material to the baby, it's carrying stem cells to the baby, it's carrying additional oxygenated blood, it is carrying antibodies to the baby, and when we clamp and cut the cord immediately, we are not allowing for all those things to pass on from the placenta, which has been nurturing the baby into the baby at the moment of birth. We also know that 1/3 of the baby's blood is still inside the placenta at the point of birth. So when we clamp and cut the cord, that one baby lands up being shy of 1/3 of its blood volume. Not only that, we also know that there is almost 3 to 6 months worth of iron supply in that extra blood that is stored inside the placenta. Now, we also know that over a course of time that there are people with less than optimal brain functioning, and one of the known reasons for that is anemia at birth. And so if we allow for this cord to pump in that extra amount of iron into the baby, then the chances of the baby's brain development happening well is also much, much higher. There's other components to this as well. When we look at the physiology of the baby, and when the baby looks at the mother and the mom smells the baby, at that point of time, there is the neurons in the baby fire exactly as the mother and baby are looking at each other. There is energetic changes, there is neurological changes that are happening at that moment, which only can be captured when that mother-baby bonding occurs immediately after birth. The baby is active, for the first 90 minutes post-birth. That's when the baby is receiving and learning everything. The baby has been hearing mother's voice and father's voice from 28 weeks. When the baby hears his or her mother speak, that's when the baby is saying, okay, I am in a safe place, I am not abandoned, and the baby starts to produce hormones of relaxation, and the mother starts to produce in her hormones of relaxation, which then allows for all other hormones like prolactin to be produced in her, which finally allows for the breast milk letdown to happen. The baby, when it is there on the mother's chest, also is able to crawl up to the mother's chest and is able to start nursing right away, and so that breastfeeding and bonding also happen. So there is innumerable reasons why mothers and babies should not be separated immediately post-birth. In case of a real emergency, we also know that resuscitation is possible right on the mother's chest. We also know that while that resuscitation is happening, if the cord still continues to pump good blood to the baby, that resuscitation can be much more effective. So all in all, it makes sense for most mothers and babies not to be separated.